Welcome everyone to meeting number 2 of the House of Commons Standing Committee on Health. Pursuant to Standing Order 106 sub 4, the committee is meeting at the request of 4 members, and in this case 6 members of the committee, to discuss recent COVID-19 developments. Today's meeting is taking place in a hybrid format, pursuant to the House Order of November 25th, 2021. However, in this case, members are attending remotely using the Zoom application. So regarding the speaking list, I would ask you to please use the raise hand function, which will make things run much more smoothly. I'd like to take this opportunity to remind all participants of this meeting that screenshots or taking photos of your screen is not permitted. The proceedings will be made available via the House of Commons website. And without further ado, I recognize Monsieur Berthold. À vous la parole, Monsieur.
Mr. Berthold, you have the floor. Thank you, Mr. Chair. First of all, Mr. Chair, I wish you a Happy New Year, and I wish all of our colleagues a Happy New Year as well. This is a new year where health will be at the heart of the concerns that many Canadians have. I would like to thank the analysts, the interpreters, and all of those who are working to make sure that this meeting works, and I hope that we're all going to have a great year. Mr. Chair, 6 members of Parliament requested this meeting, as you've mentioned at the beginning of the meeting, because Canadians are currently concerned. They are concerned about the pandemic, and no matter what their political stripes are, they are all concerned, and they're seeing how big this issue is becoming. Everyone knows someone who's had COVID. I've had COVID, and every single member of my family has also had it. We're all perceiving the effect of the Omicron variant. We're seeing it in an unprecedented numbers. Healthcare workers are tired. We're also seeing the impacts of all of the restrictions on Canadians' lives. We're seeing the impacts on small businesses and on small regions. We're seeing businesses shutting down permanently, and some people are considering a permanent closure. The cost of living is also constantly increasing. Canadians are wondering why they did not have access to rapid tests when they needed them the most during the holiday season, and now they are wondering when they will have access to treatments that can reduce the burden that the healthcare system is currently experiencing. We think that it's time to give an update on the state of our preparedness facing this pandemic, and especially facing this wave of Omicron. I would like for us to pass a motion, and to members of the committee, this is the very same content that you had in the letter that you've received. The only thing that will change is the date, because we will not have that meeting by 5 p.m. today as requested. So in this motion, we are going to request instead to have a meeting by next Wednesday. So here is the motion: that the committee hold a meeting to invite the Minister of Health, the Deputy Minister of Health Canada, the Deputy Minister of Public Services and Procurement, the President of the Public Health Agency of Canada, the Chief Public Health Officer of Canada, the Vice President of Logistics and Operations for the Public Health Agency of Canada, and the head of the National Advisory Committee on Immunization to discuss recent COVID-19 developments, including but not limited to status of support for provinces to address surge healthcare resources, current advice regarding quarantine length, availability of mRNA vaccine boosters, including procurement strategies for potential variant-specific vaccines, availability of rapid tests and status of public education on the same, status of review and procurements of promising new therapeutics, such as Pfizer's Paxlovid, access to N95 masks and other PPE, and status of domestic manufacturing capacity for mRNA vaccines. That the meeting be at least 3 hours in length, that the relevant departments for which officials have been requested be invited and asked to prioritize their attendance, but that the meeting not be delayed if they are unable to prioritize attendance at the meeting, that the total time allotted for opening statements be limited to 5 minutes by witnesses for no more than 20 minutes total to ensure adequate time for questions to be posed by committee members, and that this meeting be held on or before the end of day of Wednesday, January 19th, 2022. So that's it, Mr. Chair. And I think that we understand the importance of this motion, and we see how important this issue is to Canadians. Thank you very much, Mr. Berthold. Your motion is receivable.
The debate is now on the motion. I recognize Dr. Ellis.
Thank you, Mr. Chair. Appreciate that, and Happy New Year to everyone here on the call today. Appreciate everyone taking their time out of the busy schedule to understand the importance of what we're bringing forward here to all the committee members, in the sense that we really believe that there's a failure of federal leadership here in terms of the ability to manage this pandemic. And of course, what does that leave? That leaves, unfortunately, the provinces with simply the ability to continue to restrict and to lock down Canadians. And that, of course, is having significant negative impacts on mental health, on suicide rates, on the abilities for people to do business, et cetera, et cetera. And I think that when we realize that all that we've given provinces is the lockdown mandate, in the sense that all of those things that my great colleague, Mr. Berthold, mentioned, potential for therapeutics, the rollout of rapid antigen testing, all of those things are going to be really, really important as we go through this pandemic. We know that we're almost into the third year now. We also understand that there has been poor planning since the very beginning, that the acceptance in the early days of mRNA vaccines and the procurement thereof has been sadly lacking. Clearly, obviously, in the last several weeks, the procurement of rapid antigen tests has also been sadly lacking. And finally, of course, domestic manufacturing of rapid tests, of vaccines, of PPE has also been non-existent. My dear colleagues, I would say that if we were in a wartime state now, we would be actually fighting a war without bullets and without guns. And that's the type of footing that we're on now, and we're seeing these disastrous effects. I think the other thing that's important to remind people of is the sad underfunding of healthcare, the poor transfer payments that we've been continuing to see from the federal government to provinces is just unacceptable. And we continue to blame lockdowns on the system when the system has been sadly underfunded for such a terrible long time. We also all clearly know that there have been significant amounts of backlogs in the system even before COVID happened, and there's absolutely no way that in this earth that we're going to be able to catch up on the backlogs at the current time, given the stress on the system. So all of those things packaged together, again, in my mind, point to a clear lack of federal leadership in the health system, and the significant need and the responsibility that we all have here in the Health Committee to ensure that we update Canadians on what's going on, and so that Canadians can begin to have some hope moving forward. We know that the majority of Canadians have lost hope, and they've lost hope because there hasn't been good federal leadership. So those are my points, Mr. Chair, and I appreciate everyone taking the time to be here again today. Thank you.
Thank you, Dr. Ellis. Ms. Kramp-Newman, please.
Okay, thank you, Mr. Chair. I'd certainly like to start by lending my voice as to why I think this particular meeting is needed. The way I see it, we're asking the minister to appear for two different reasons, very separate. The original request, of course, is to have the minister deal with a run-of-the-mill type of housekeeping that deals with every committee, and the minister at the commencement of every session, and of course, a new parliament. We have the fall economic statement to discuss, mandate letters, supplementary estimates, et cetera. And I certainly doubt that our Liberal colleagues would dismiss any of these as being unworthy of committee time. I also doubt that they would dismiss the severity of this ongoing Omicron variant that is sweeping across Canada and across the world. It's certainly putting pressure on healthcare systems all over the world. I am confident that Canadians at home watching this would agree that it deserves a dedicated meeting between us, the standing members of health and the minister. as members of this committee, we need to be able to do our jobs. And right now, that requires the minister's undivided attention, which I am certain he'd be more than happy to provide. I do think there's also another very unique benefit for us meeting here on a matter specific. This variant, along with massive surges in cases, has also brought on a massive surge in division and rhetoric. Unfortunately, we've been grown accustomed to see theories targeting those that are vaccinated, or insults and demeaning comments aimed towards those that cannot or choose not to get vaccinated. Both are unfortunate, both are wrong, but both were expected. What was not expected was when I heard these comments coming out of the mouths of our leaders. Sadly, it's unacceptable, unbecoming, and undeserving of high office, of any office. For the Prime Minister to bring the character of any of my constituents of Hastings, Lennox, and Addington into question over vaccination status is deplorable. I personally am fully vaccinated. I got my booster this week. Vaccines work, but I do respect the decision of those that chose not to. As parliamentarians, as an institution that's been created to represent all Canadians from coast to coast to coast, it is incumbent of us to approach this situation, this issue as a committee with the goal of finding the solution to both the question of Omicron and of vaccine hesitancy. The only thing that most Canadians see are all of us at each other's throats over 5-second sound bites or snide blasts on Twitter. This is not the Canada we know, and I have every intent to be forthright, productive, and a voice for my constituents. We need to invest in educating and encouraging prevention and a healthy focus. We need to lead by example instead of divide. Working together and positively, I believe that we can do this. We can do it here, not as Liberals, not as Tories, not as Blockists and NDPers, but as parliamentarians and as Canadians on this health committee. Thank you, Mr. Chair.
Thank you, Ms. Kramp-Newman. Mr. Van Koeverden, please.
Thank you very much, Mr. Chair, and thank you to my colleagues, both well, so far. I really appreciate all of the comments. I think there's some very salient points raised, and I also really want to echo what MP Kramp-Newman referenced with respect to our mutual obligation to work together beyond our party affiliation on this committee. Canadians are counting on us, and they demand and deserve a really effective health committee. So, in that regard, I feel very fortunate to be on the committee with so many people who are like-minded and who have similar ambitions to serve our constituents in Canada, and I'm happy to be having a meeting next week. In fact, I recall back on December the 13th, it was raised that we possibly would be reconvening for a meeting at some point in January, and I'm glad that we are. And I would say that a 1064 is one way to get there. We can also, in future, rely on each other. We have each other's contact information, and we can convene for the mutual benefit of all of our constituents. On the topic of funding from a national level, I think it's important to recognize that the government of Canada has invested incremental billions to help provinces and territories strengthen their healthcare systems over the last couple of years, very difficult years. They've increased the testing capacity, and they've stopped outbreaks from happening, and those include outbreaks in long-term care. In 2020 and 2021 alone, the government of Canada provided $42 billion in cash support to provinces and territories through the Canada Health Transfer, and that grew to $43.1 billion the following year, this past year. In 2020 and 2021, $9.7 billion was sent to Quebec alone. So we'll continue to work directly with our provinces and territories to fight COVID-19 together, because it is nobody's fight alone. Every Canadian is sick of these lockdowns. I call them, definitely count myself among them. I'm sick of doing online Zoom. I would way rather be in the same meeting room as all of you, and I'm looking forward to getting back to that as quickly as possible. However, I soundly refute the suggestion that the federal government is responsible for lockdowns. If that were true, then then there would be lockdowns in a similar way in every single province and territory across the country, and that's just not the case. But we have continued to support provinces and territories. And on the topic of PPE, we have procured more PPE per capita than probably any other country. Different types of masks are available for public use. Many are available in stores for low cost or free in the case of many communities. On rapid test kits, to date, we've shipped over 89 million cases of, test kits to provinces and territories, and 35 million alone, one for each Canadian back in December 2021 alone. And we just recently announced that an additional 140 million rapid tests, which is enough for every Canadian to take one through the month of January and February, will be delivered to provinces and territories in the month of January 22 alone. We are doing what it takes to fight this pandemic. And, on boosters, vaccines absolutely remain the most important tool to stopping the spread of COVID-19. And I appreciate the sentiment in that regard from my colleague, MP Cramp-Newman. And I'm happy to hear that you got your booster. I also got my booster. Really want to say thank you to the Prime Care team in Milton, who set up a clinic just this week to fully vaccinate every Miltonian that hasn't yet received their last dose. But on December the 3rd, the National Advisory Committee on Immunization released more guidance, and we will continue to follow all of those. There continues to be solutions in the future that we haven't yet necessarily been able to take advantage of yet, and those, as my colleague from Nova Scotia, Dr. Ellis, referenced, antivirals and other medications to ensure that people who are hospitalized don't have to go to the ICU. And for those who might have gone to the hospital otherwise, taking an antiviral pill will be a solution. And our government has signed an agreement with Merck & Co. to procure 500,000 treatment courses of this oral antiviral with a name that I won't even try to pronounce because it's a little bit difficult. Unlike my colleague, colleagues, Doctors Pawlowski, Ellis, and Hanley, I don't have a medical degree, so I don't know if you take a course in how to pronounce some of these pharmaceuticals, but we've also signed an agreement with Pfizer to procure an initial quantity of 1 million treatment courses of the oral antiviral from that company, and we are waiting for authorization from Health Canada, which is forthcoming. Vaccination continues to be the absolute most central tool that we have in fighting COVID-19, and it will provide Canadians with additional treatments as we're going forward, in addition to, but not instead of, vaccines, I would like to say. Additional measures are definitely necessary due to this difficult Omicron time that we've all found ourselves in. But I would also say that because of my former career as an athlete, I got to travel a lot, meet a lot of people from other countries. Everybody in the world is going through this Omicron thing. It's not an issue that's endemic to Canada. And I will say that my friends from the UK, my friends from Australia, my friends in Germany and Sweden and Norway, they're going through the same thing. And I think we're doing quite well. I think we should be proud of our system. I think we should be proud of our officials. And next week, when we welcome them to this committee, I hope that we will express that because our communities are in good shape. Our healthcare teams are stressed and tired, but they have our support. And our officials also need to feel that they have our support because we are on one team. This is not one party versus another in fighting a pandemic. We are on Team Canada. And I thank my colleagues for their Team Canada approach on this. Partisanship is not going to get us through this pandemic, is not going to make things happen faster. It's not going to save more lives. We are all in the business of saving lives here on this committee and in this government. So let's get to that work. Let's welcome our officials and the minister to this committee next week. Let's thank them for their hard work because nobody's worked harder on this pandemic than these folks. We do owe them a debt of gratitude, while at the same time demanding some accountability. I appreciate that accountability from my colleagues here, looking forward to having that conversation next week. And I thank you for taking me up on my invitation that I sent out in committee on December the 13th. I said, if you'd like to meet in January, then just let me know. We went a little bit of a circuitous route with the 106, but you know what? It worked, and here we are. So I'm happy to see all of you guys. Happy New Year, and I'm looking forward to the meeting next week.
Thank you, Mr. Van Couverden. Mr. Williams, please.
Thank you very much, Mr. Chair. And I think we're all agreeing here, which is fantastic. Canada needs a team Canada approach. I'll agree with my colleagues on that and our members. The government should want to work with the opposition in tackling this crisis. And I'm glad that we're all here today. And I look forward to hopefully we be meeting next week and discussing this. At the very least, if Parliament is not meeting, this committee should be meeting in preparation for Parliament on January 31st. And all the solutions to the problems that plague this country, the lockdowns, hospital capacity, lack of PPE, lack of emergency testing, nurses and doctor shortages, antiviral medication, Health Canada approvals and vaccine readiness should all be debated in this committee, and with the recommendations not coming fast enough to all of Parliament. And I think we've heard that from all of our colleagues. First on the list is why Canada has such a low capacity rate in our hospitals and little to no surge capacity as this pandemic nears its peak. This pandemic touches every single part of the country, the health, mental health, and well-being of the entire populace, and the economic well-being for everyone. So I'm going to be very brief today. Let's get to work. It sounds like we're on the right path here. Let's all agree to hear from our health professionals, our government, from all of our parties as we fight our way out of this pandemic together. Thank you very much, and let's get to work.
Thank you, Mr. Williams. Dr. Pawlowski, please.
Thank you. Happy New Year to everybody. So I'm hearing a little bit of two messages. I think the overwhelming one from the Conservatives is this is Team Canada. We're all on the same side. We're all working towards the same goals, although there was a smattering in there of it's all our fault, we suck. And it's all because of we suck that we have these problems we have now, which I don't agree with, and I won't enter into that conversation. But I do encourage the working together. I think at least the beginning of the last session, I think this committee worked very well together. I think we've got a great mix of people on this committee from various backgrounds, including a bunch of people with medical backgrounds. And I think we can really, in a fairly unique way, because we are a group of members of Parliament, we're discussing this issue. So we have a fairly unique ability to shine the light on various issues with respect to COVID, whether that's the value of rapid testing or the value of therapeutics, which I certainly talked about a lot in the last session. And I think we did a pretty good job actually with COVID. I believe our committee was one of the first to talk about asymptomatic transmission, i.e. transmission of COVID by people who are asymptomatic, before it was really much in the press. The need for mandatory masks, spacing, intervals between vaccines. I think we were all pretty well on top of that. And I kind of hope that the fact that we publicized it may have in some way contributed to faster action. So I am glad to hear these words coming from the Conservatives, and I take it it'll probably also come from the other members from the other parties, that let's work together. I think we can do a valuable job, and this sucks. I know my family, my kids are in the other room. They're not at school. Their hockey games were all canceled. The season's canceled. My parents are going nuts in Thunder Bay because it's 20 below every day, and they're used to being in Mexico for the last 20 years. And the businesses are suffering. People with mental health problems, overdoses. It goes on and on. This is an extremely important thing. Let's try to put partisan politics behind us and work together to shine a light on problems and make some useful suggestions as to how to deal with them.
Thank you, Dr. Pawlowski. You have a way with words. Mr. Davies, please.
Well, thank you. Well, first of all, I just want to thank my colleagues in the Conservative Party for their initiative in calling this 106 meeting. It appears that violent agreement is breaking out. So I will keep my remarks uncharacteristically brief. The only thing I would just like to mention is that the Health Committee hasn't had an opportunity to meet since early last July. So it's been about 6 months, a little over 6 months actually, since we've had an opportunity to meet. And you know, I'm hearing a little bit of damning with faint praise, and I'm hearing a little bit of very positive, I think, commitments to collegiality and working together, with a little bit of a little tinge of politics in there. And I think that's exactly as it should be. But what I would say is this is, I've had the privilege of being on the Health Committee since 2015 with, I think, my colleague, Sonia Sidhu. I think we're the grizzled veterans of the crowd. And I just wanted to say that I think that HESA is one of the very few places in our country where we have an opportunity to really question issues, to you know, call whoever we want to our committee to receive the best evidence that we can, to hold officials and government to account. And I think that's a really important role that we play. And I know that I think each one of my colleagues on this committee takes that role very seriously. So I'm just really looking forward, as the New Democrat critic for health, to not only working together, but also to being that crucible of accountability and open questioning that I think is important in a free and democratic society. And I'm hoping that all of my colleagues, you know, feel free to bring the witnesses and evidence forward that they think is important, sometimes to give voice to the voiceless, sometimes to critique the orthodoxy, to challenge established narratives, and to do what I think Canadians want us to do, which is make sure that Canadians have access to the very best health policy at the federal level that we can possibly deliver to them. So, Mr. Chair, I congratulate you again on your election to the chair. I look forward to working under your wise stewardship, and I look forward to working with everybody else as we meet next week to begin our work.
Thank you, Mr. Davies. Dr. Hanley.
Thank you so much. And I want to, first of all, greet everyone with a Happy New Year as well. And I want to maybe start out from the beginning, especially as a new member, not only new on this committee, but as a new MP, to repeat the calls for setting the right tone and working together. I did partly joke with my colleagues when I first was elected that everything I learned about politics, I learned in public health in my previous role. To me, this is about health and progress first, and politics second. And I like the way that the previous member described the tinge of politics. But let's keep it as perhaps a tinge to jostle and to encourage us to be accountable. But let's aim for progress. On the federal support, I think I really like to listen first and then make conclusions, and not perhaps set up the next meeting with foregone conclusions. But I will say, as having been a CMOH from the beginning of the pandemic, that having feeling the federal support behind us, whether that was vaccines, whether that was helping us to collaborate on our meetings, our FBT meetings, whether it was the advice from Public Health Agency, the modeling, and not to underemphasize the economic supports, the massive economic supports that we needed to get us through, and that we still need to get us through the pandemic. So I, as a public health leader, was constantly grateful and appreciative for the federal support that we had. So that's that is the premise that I want to try to establish. Was it a perfect response? By no means. And did we learn lessons? Absolutely, and we should be taking every lesson we can for the rest of this pandemic and for the next. I think humility, I certainly learned the value of humility and learning from my colleagues, learning from experience, learning from our mistakes and improving. And I have to agree that I think overall Canada has borne this very well. I will also say that Omicron has completely changed the paradigm and has perhaps surprised us by the degree to which public health measures there from the beginning are still necessary, in addition to all of the other tools and amazing new tools we have. I'm also going to say molnupiravir, just to say that I can say it. And to echo that we are entering a new era, which I think is a potential game changer. And I'm so pleased again to see that the government stepping up with the acquisitions that will be required. I want to just touch briefly on a couple of things. First of all, just to ensure that in the motion, pour le membre qui a proposé
it was suggested that territories be included and not just provinces. I know that is the intention, but I would like to be very clear that territories are also always included with the provinces.
I would like to echo the availability that perhaps in terms of being available to each other for preparation for meetings. I think I see no reason that needs to be staying within party lines. I would also like to reflect on the other members' comments around healthcare worker exhaustion and burnout. I think we have to continually remember that in the context of what we are about to hear and what we are constantly hearing, that our healthcare workers, whether in the public health workforce or in the clinical workforce, are tired and exhausted. I do want to see us move through this review of the pandemic progress to the consideration in committee of how do we support our healthcare workforce recruitment and retention of all of the layers of our healthcare workforce, from physicians to nurses to technical support, and that be one of our priority studies for the committee work going forward. Thank you so much.
Thank you, Dr. Hanley. Monsieur Thériault, vous la parole.
Mr. Thériault, the floor is yours. Thank you, Mr. Chair. So I would also like to wish everyone a new year, 2022. I hope it will be as great as you expected. I wish you a lot of satisfaction and very little frustration. We are going through one of the worst health crises that our humanity has ever lived. In such a crisis situation, we need to make sure that we have buy-in from the population. This is what will enable us to promote best healthcare practices. So we need to be able to ask questions on important issues and answer questions that people are asking themselves. We are in a context with a lot of misinformation, of course. So our role will be to go beyond partisan lines, to go beyond partisan comments. We need to be able to question and to shine a light on relevant information. We need to be able to ask witnesses useful questions. In my opinion, the motion, as phrased, reflects this cross-partisan intent. It reflects our will to shine a light on this important information. Mr. Chair, I'd like to say that in the face of all this goodwill and good intentions towards collaboration, I think we are ready to move forward. I see that Madame Sidhu wants to speak. I'm just so happy that everyone wants to hold this meeting. That will be, I hope, the first of many.
Merci, Monsieur Thériault.
Thank you, Mr. Thériault. Ms. Sidhu, please.
Thank you, Mr. Chair, and Happy New Year to all. As Mr. Davis said, we are all veterans of this committee. It was a pleasure to work with him and all other members. We were together from 2015 in Health Committee. And I want to welcome all new members to this committee. I know we will do a lot of important work for Canadians this time as well. I think we can all agree that Canadians' health is our top priority. I'm happy to hear, we are all happy to hear from Minister and other official. I know when we met in December, Mr. Van Koeverden volunteered to have the minister here without any committee member asking before that, he said, because we all want to do a good work. And Mr. Van Koeverden was saying the government of Canada provided a significant support to provinces and territories. And Mr. Chair, 8 out of every $10 spent on the fight against COVID-19 has come from the federal government. Bottom line, Mr. Chair, we should put politics aside and come together as a committee to confront this world crisis. As we begin our work together as a Parliament's Health Committee, I look forward to constructive work for all Canadians. So let's find a way to work together moving forward. That is what Canadians want us to do. So in the spirit of that, I think we can all support this. We can vote on this motion when all members have spoken.
Ms. Sidhu, Mr. Berthold.
Oui, merci beaucoup.
Thank you, Mr. Chair. So this will be very brief as a proposal. I would like to suggest a friendly amendment from Mr. Henley's suggestion to add territories to the motion. And so the support to provinces and territories. If everyone agrees on this, then I would be happy to add this to the motion before it's adopted. I think that is a suggestion that deserves to be supported. So if everyone agrees, I'll consider it a friendly amendment to the motion before we proceed to the vote, Mr. Chair.
Merci beaucoup.
Thank you, Mr. Berthold.
Despite the conventional wisdom around friendly amendments, I'm advised by the clerk that there really is no such thing, but it is absolutely in order for the committee to do exactly what you have suggested, and that is by consensus agree with the suggestion of Dr. Hanley that the words and territories be inserted after the word provinces in your motion. Do we have general consensus on that? If not, we can proceed more formally. I see consensus in the room. The motion is accordingly adopted. I see no further speakers on the speakers list, and therefore we are ready for the motion as amended. Do we have consensus to pass the motion as is, or do we require the formality of a standing vote? I see consensus in the room. The motion is therefore adopted as amended. Is there any further business to come before the meeting?
Mr. Speaker.
Yes, Mr. Berthold.
Just
for logistic reasons regarding the time of the meeting, I assume the clerk will keep us aware of when most witnesses are available. I think the goal is to find a moment where the majority of people named in the motion are available to appear with the committee. I think we are all available to come when needed. You are very right. And the motion includes a deadline that is Wednesday. So invitations will be immediately sent to the witnesses, exactly to do as you've described. The most convenient day will be chosen, and a notice will be put out soon when that is determined. Thank you.
Is there any further business to come before the meeting? Do we have consensus to adjourn? I believe I see. Oh, no, we have Mr. Van Couverton. Go ahead.
Just so that everybody has a really good weekend, I thought I would let you know that the minister is available Tuesday and Wednesday, so it will likely not be a Monday meeting, but look forward to seeing you guys next week and enjoy your weekends.
Thank you, Mr. Van Couverton. Dr. Pawlowski.
I just wanted to say, because I think this issue is going to come up, and hopefully we all start thinking about it. How are we going to deal with COVID and at the same time start dealing with the very many other medical issues that have kind of been on the back burner for the last 2 years? I think a lot of us know personally people who've suffered as a result of COVID, not because of COVID per se, but because of lockdowns, because the hospitals aren't functioning, et cetera, et cetera. And how are we going to both deal with COVID and talk about the very many other issues facing the medical system? Is it going to be like one day COVID, one day, the next day non-COVID? But anyhow, I hope we all start contemplating that, because I think it's an important issue. Thanks.
Thank you, Dr. Pawlowski. With the goodwill that I see on display today, I'm sure we'll be able to pull it off. There being no further speakers, is it the will of the committee to adjourn? I see consensus. The meeting is adjourned. Thanks, everyone. Have a nice weekend.
Thank you. Good night.